Hi, my name is Judith. I'm the principal at the Mallow and Fermoy Osteopathic Clinics. Today, I have my colleague Marine.
Hello.
Hi Marine, how are you doing? Thank you very much for coming to talk to us.
Thank you, Judith. Thank you.
So today we're going to talk a little bit about neck issues that people may have at the office or at home when they're working. We have completed a full-time degree course, a 4-year full-time degree course in osteopathy. So when patients come in through the door, they're taken through a detailed case history and we make sure that it's safe to treat the patient. So Maureen, do a lot of patients come into the clinic, office workers, with this type of issue with neck pain and back pain?
Yeah, it's quite common, especially if you're working for long hours or if you're hanging on the phone on one side. So it can create some soreness on one side or the other one, or some soreness on the back, just on your shoulder here, so your trapezius muscle. So today we're going to give you a few tips for releasing your pain and feeling better in your body.
Perfect. Yeah, so a lot of people would come in complaining of this area. We tend to hold an awful lot of tension in our shoulders. And I suppose there's a huge amount of muscles that come from the shoulder, that come up to the back of the neck, from the collarbone area as well, and from the spinal column. So if there's any restriction of the neck or tightness of the muscles, that can in turn cause neck pain or headaches or drainage for the sinuses. Often people can have issues.
Yeah, exactly. You can even have any ear pain or any jaw pain. People can have teeth pain as well. It's quite common because the area is really tense and the muscles are really tense. So as Judith said, the blood flow decrease and there's a lot of tension there. So we're going to need to work and release that tension and to open all this area. So it's quite often as well. So it's not just for office worker, the exercise that we're going to give you today. Can be also if you have any stress in the moment, or if you have any emotions and you tend to hold it on your mouth or you grinch your teeth. So they're going to help you a lot with that.
So can you show us a couple of exercises that people can easily do at home or in the office?
Yeah, of course. And they're going to be great as well for the neck exercise. If you're suffering from any headache or any tension type headache, you will find it much more easier with dealing with any evening time as well, especially when you're tired. So the goal is it's all in the sitting position, so you don't have to move, but if you want to do it standing, it's up to you. You can do it as well. The goal is going to be to stretch first this part of the neck. So you're going to put one hand on your collarbone or your shoulder like this, and one hand on your jaw. And what you're going to do, you're going to take a deep breath in. And when you breathe out, you're going to look to the left and stretch this part. So you might going to feel the stretch in here. You can stretch as well this part by putting your left hand on your right part of the bone just here. And then the same, the right hand on the shoulder. And the same, you take a deep breath in. And when you breathe out, you're going to look to the left and down. Okay. And then the last one, you're going to put your left hand at the back of your head, so on the right side here. And again, you take a deep breath in and you look down into the left. So they're going to stretch the anterior part of the neck, the middle part of your neck, and then the back part with your trapezius muscle. And you can do the same on the left side. And what you're going to do just after stretching, we want to strengthen the muscle. So they're going to stretch the anterior part of your neck, and then the middle part and the back part with the trapezius muscle.
So you're incorporating a huge amount of areas there because you've got muscles coming from the back of your neck into your shoulder. You also have all the anterior throat muscles into your collarbone. And then you've got muscles coming from the back of the skull going right down the spinal column and also going into the shoulder blade. So you're literally doing from the bra strap up to the top of the head. All that area is being stretched. So it must feel quite good to have that sort of a stretch, especially when you're on the computer or if you have a headset on all day, or if you're doing a lot of writing, because all of the pull comes all the way up from the shoulder up to the neck. So it must be quite great. It must be great to stretch that whole area.
Yeah, exactly. And don't worry if you feel any burning sensation. So it's normal because it's working on the fascia, and the fascia, it's the envelope of the muscle. So it's allowing the muscle to have a nice flexibility and fluidity. So sometimes people, when they especially at the first time, when they start to stretch that, they can feel some little burning sensation and they're like, oh, that's quite painful. But the more you're going to do it, the less you're going to have this burning sensation and the easier it's going to be to stretch.
And the amount of stretching that you're doing and the amount of pressure that you're actually putting on your body is very, very minimal.
Yeah, exactly. So really this hand is just to guide the head rotation, so to help you turning the head on the left. And this one is just here to stabilize the shoulder and to do like a resistance point. So with the left hand, just slightly engaging to the left. And the whole part's gonna be with the breathing. So the more you're gonna take deep breathing and deep breathe out, and the more stretch you're gonna have, because the breathing, the lungs, here you have the top of the lungs. So taking a deep breathing gonna increase the stretch, especially when you're breathing out. So you can do this both sides, the left and the right. You might gonna find that one side is tighter than the other one, so that's great. That's making you much more aware of your body. So don't hesitate to insist a little bit more on the side that feels that need more stretch. And then what you're gonna do next is some strengthening in your muscle. So it's gonna be the same position, but this hand, so the left hand, gonna go at the top of my skull, on the right side of my skull. And what I'm gonna do, I'm gonna push gently with my head to the right side for 3 seconds. So 3, 2, 1, and then I relax. I take the time to breathe. Breathing is really important for the blood flow as well. And then I do a second time.
So the head is being pushed
exactly
to the right.
Exactly.
Perfect.
It's like you want to do this movement, but you're actually resisting with these hands.
And the shoulder stays down. The shoulder does not
Mm.
rise
Yeah.
up towards the ears.
Yeah, the same principle as the stretching exercise. So again, you push 3 seconds to the right side. And then you breathe out and then you relax. If you feel that it's creating any pain in the neck, you can take a little break. So you can take a little break. Just take the time to breathe. And then if you want to do it again, you can repeat the same action, maybe less stronger. It's all about what you can do and how do you feel with that. If it's painful, just maybe do it less stronger. If you feel okay with that, you can do it maybe up to 5 times. So again on the right, 3, 2, 1, and relax. Okay, so you can repeat the same action on the left. So my right hand goes on the top of my left skull, and then I push to the left side, so like this.
And there shouldn't be any intense pain there. You should feel a stretch.
Yeah.
But if people have pain, just stop. But it'll be like a stretch like you do in yoga or Pilates.
Yeah. Exactly. It shouldn't be intense, as Jude said. It's normal to have pain, because especially when we in sitting position, so we're locking the head, and usually we're taking this head posture. So you see my spine are really like going forward. It's like it's bending forward. So what we really want to do is to give back this position. So it's normal that it's painful at first, because you're activating some articulation and some muscle that aren't really used to be activated anymore because of this really sedentary posture. So what you're going to do as well, you're going to do the same principle, but to the front. So you're going to put one hand on your sternum, so there on your chest, and you're going to put your head a little bit forward. And what you're going to do is to push forward.
So the head is going forward.
Like this.
Yeah.
So it's like you want to do this movement, but you resist with this hand. And again, you take a deep breath in, and you push forward, and then you relax and breathe out. And that's going to activate this muscle, okay? So to the front. And then you can do the same thing, but with the back. So you put your right hand on the back of your head. You bend a bit your head forward, so like this. And so this hand doesn't have to be anywhere. And you want to push backwards. So like I want to do this movement. Exactly. So like that. If you don't feel it, you can put both hands at the back of your skull. So like this. And push backwards.
And that's going to be fantastic for everyone, because everyone now is on their phones. People are looking at their iPads. So everything is neck flexion. So we're always looking down the whole time, which puts a massive pull and drag right into the back of those muscles, into the back of the head.
Yeah, exactly. You're going to feel... Usually people that are working in sitting position, they feel a lot of pressure on this joint, so this area of their body. So doing this exercise is really going to help to ease this pressure and to decompress this area.
And I suppose people that have issues with their neck, they can have so many other issues coming in, and that it might start off with neck pain, but then they can have a lot of other issues with the neck pain that are associated to tightness, restriction, and problems within the neck.
Exactly. And when I say to my patient, because sometimes they want to click their spine, you know, they want to do like this, and then they're hearing a little click. So I don't recommend to do that. Instead of wanting to clicking your spine, just try this exercise and involve your muscle, because actually your muscle are going to stabilize your articulation, and to click the spine, they're going to engage more instability in your articulation, and that's what we don't want. We don't want to have instability in the cervical spine, especially because it's really fragile, the cervical. So instead of wanting to click it, just strengthening your neck gonna be really, really good for your pain and for your health in general. So you can do this exercise twice a day, or if you want to do it more, maybe every 2 hours. What I recommend personally, it's one time in the morning and one time in the afternoon when while you're working and while you're sitting, especially if you feel that you have this pain. So don't hesitate to do it while you have this pain, and try to compare how was my pain before I did the stretching and the exercise, and how is it now. Does that help? And you will see your pain improving from week 1 to week 2 to week 3, etc. And then you want to do, so this exercise, the fact that you're pushing to the side, pushing there, pushing to the front, and pushing backward, you can do it 3 to 5 times, so 3 to 5 repetition. And as we say, 1 in the morning, 1 in the afternoon.
That's fantastic. And it's such a simple exercise. Anyone can do it at any time, whether it's at the home or at the office. So I suppose that's the neck kind of looked at. So thank you very much for watching. If you'd like the video and if you'd like to send it on to anyone who would benefit from an osteopath, you can send them on the link. We are on all of the social media platforms.
Yeah, Instagram, you can find us on Instagram, Facebook, LinkedIn, or even we have a YouTube channel.
And so there's loads more videos and more to come on my YouTube channel, My Osteopath Judith. And you can find out loads more information, both Marine and myself and Damien, on our websites, malloosteopaths.com and fermoyosteopaths.com. And if you would like to make an appointment at the Mallow or Fermoy Osteopathic Clinics, please ring 022 51751. Thanks a million for watching.
Don't hesitate to share this tip with your colleagues.